Hello, my name is RThornton, and I'm a first-year student enrolled in the Psychiatric Mental Health Nurse Practitioner program at CSU Pueblo. Join me today as I will be giving a presentation over the neurotransmitter theory of mental illness. Some topics we will be going over as they relate to this theory are history, origins of the theory, major posits of the theory, defining concepts of the theory, application of the theory, and current status of the theory. Okay, so let us refresh on some basic concepts before we head into this theory. Neurotransmission is defined simply as a network of connections that our brain uses to communicate within itself and the outside world. However, according to Stahl, neurotransmission has an anatomical infrastructure, but it is fundamentally a very elegant chemical operation. Neuroscience studies how the nervous system develops, its structure, and what it does. Neuroscience focuses on the brain and its impact on behavior and cognitive function. Not only is neuroscience concerned with the normal functioning of the nervous system, but also with what happens to the nervous system when people have neurological, psychiatric, and neurodevelopmental disorders. Understanding the principles of neurotransmission and neurobiology is fundamental for grasping how psychopharmacological agents work, because these agents target key molecules involved in neurotransmission and ultimately how we treat mental illness. Donald Hebb was born in 1904 and died in 1985. He is often considered the father of neuropsychology because of the way he was able to merge the psychological world with the world of neuroscience. This achievement was accomplished largely through his work, The Organization of Behavior. It's a neuropsychological theory that was published in 1949. Hebb's theory is still relevant because it is a general framework for relating behavior to synaptic organization through the development of neural networks, aka neurotransmission. Donald Hebb describes neurotransmission as not always linear, but apparently involves some closed or recurrent circuits. He also believes that there are both genetic and environmental factors that contribute to mental illness. I just wanted to highlight how Dr. Hebb's work really laid the foundation for this theory. You can see his rudimentary drawing of neurotransmission versus an actual picture of neurons and see how accurate he was. It was very thought-provoking and very forward-thinking for a man writing this in 1949. Okay, so this is the timeline that represents how the neurotransmitter theory of mental illness evolved. In the 18th century, hospitals or insane asylums began to crop up in the U.S. to help care for and manage those diagnosed with a mental illness. At this time, there were no effective treatments for mental illness, just theories. The peak of institutionalization was in 1955. It was considered an epidemic. In the 1940s to 50s, they began experimenting with different interventions to help cure mental illness. But one in particular was very controversial, the lobotomy. It was a surgery used to disrupt the prefrontal cortex. The use of this procedure increased dramatically from the early 40s into the early 1950s. And by 1951, there was almost 20,000 lobotomies that had been performed in the United States. This was when we really started to understand that neurological connections within the brain, specifically the frontal lobes, were connected to personality and to behavior. Although barbaric, damaging these neural connections did work. They did help to lessen the symptoms. In 1950, Thorazine was discovered, and it was the first effective treatment for schizophrenia and psychosis. A steep drop in inpatient hospital admissions followed as patients were able to be cared for safely in the community. This is also very important because psychopharmacology became a distinct discipline based on the neurotransmitter theory of mental illness. Next, I will share a video of neurotransmission in action. The neurotransmitter theory of mental illness aims to explain mental illness as an abnormal biologic cause. Scientists understand that mental illnesses are associated with changes in neurochemicals. For example, people who have depression, less of the neurotransmitter serotonin is released into the synaptic space than in people that do not have depression. Between 1954 and 1975, about 15 antipsychotic drugs were introduced in the United States and about 40 worldwide. This era really highlighted psychopharmacology, neurotransmission, and our understanding of mental illness as a biological process. This stemmed from Belgian cyclists that were using amphetamines to enhance their performance. They often experienced psychosis after using amphetamines, and based on that chemical structure and the knowledge that it caused psychosis, typical and atypical antipsychotics were discovered. We know that drugs often mimic the brain's natural neurotransmitters. Some drugs have been discovered prior to the natural neurotransmitter. Next, we are going to talk about some defining concepts of the theory, neurotransmission and biological psychiatry. The basis of biological psychiatry is the belief that mental health disorders are actually disorders of the brain itself. Biological psychiatry emphasizes the connection between brain functions and behaviors. The goal is to prove that physical factors can cause mental health disorders. Psychotropic medications and other medical interventions play a big role in biological psychiatry. The biomedical model proposes that mental disorders are brain diseases and emphasizes pharmacological treatment. This targets presumed biological abnormalities. Also, going back to neurotransmission. A biologically focused approach to the science and practice has dominated American healthcare as it relates to mental health. During this time, the use of psychiatric medications has sharply increased, and mental disorders have become commonly regarded as brain diseases caused by chemical imbalances that are corrected with disease-specific drugs. Next, we're going to be going over the 6 key important neurotransmitters used in psychopharmacology. The first is acetylcholine. Its function is to enable muscle action, learning, and memory. Some examples of malfunctions with that would be with Alzheimer's disease. Acetylcholine producing neurons deteriorate in that disorder. Next, we have dopamine. This influences movement, learning, attention, and emotion. An oversupply is linked to schizophrenia, while an undersupply is linked to tremors and decreased mobility in those diagnosed with Parkinson's. Serotonin. This affects mood, hunger, sleep, and arousal. Undersupply is linked to depression. Some antidepressant drugs raise serotonin levels. Norepi, this helps to control alertness and arousal. Undersupply can cause a depressed mood. GABA, this is a major inhibitory neurotransmitter. Undersupply is linked to seizures, tremors, and insomnia. Glutamate, this is a major excitatory neurotransmitter involved in memory. Oversupply can overstimulate the brain, producing migraines or seizures, which is why some people avoid NSG in food. The neurotransmitter theory of mental illness can be used to explain behavior, specifically mental illness. Stahl says dysfunctional neurotransmission in various brain circuits is implicated in both the pathophysiology and treatment of mood disorders. So for bipolar disorder, disruption in ion regulation is the cause. According to this theory, this leads to increased neurotransmitter release and firing. It's chaotic, causing symptoms of mania. As neurotransmission is further damaged, the depressive symptoms develop and may lead to the ultimate expression of ionic dysregulation, which is catatonia. Depression. This can be explained and understood from a neurochemical perspective as well. Using this theory, neurochemical depression results when levels of certain neurotransmitters are altered, especially norepi, serotonin, and dopamine. On a cellular level, the neurons these chemicals activate have lost the capacity to respond in a healthy manner. This can cause symptoms of depression, such as depressed mood, diminished interest in pleasure or activities, insomnia, fatigue, and feelings of worthlessness, just to name a few. Schizophrenia. One of the prevailing theories of schizophrenia is the dopamine hypothesis. According to this neurotransmitter theory, excessive dopaminergic activity in limbic areas of the brain can cause acute positive symptoms of schizophrenia, such as hallucinations, thought disorders, and delusions. This can be a result of increased dopamine synthesis, increased dopamine release, or an increase in activity or number of dopamine receptors. In one study, genetic commonality across 6 major neuropsychiatric disorders, attention deficit hyperactivity disorder, anxiety disorder, autistic spectrum disorder, bipolar disorder, major depressive disorder, and schizophrenia were tested. The study is relevant to this theory because many of the shared genes are implicated in the postsynaptic density. The postsynaptic density plays an important role in neurotransmission. Basically, it's an electron-dense structure beneath the postsynaptic membrane of excitatory synapses, and it's usually located at the tip of the dendritic spine. Some distinct genetic components that were shared by each of the 6 disorders involved CNS development, again, neural projections, and synaptic transmission. Again, going back to the neurotransmitter theory. This shows that neurotransmission and the biology of neurons and their dysfunction play a key role in the development of various mental disorders. There's still much to be learned, as you can see from this Venn diagram. It kind of leads to more questions on why they overlap so much. It's a great theory if you're able to specify specifically what is being triggered, what neurotransmitter is being activated, but you can see there's a ton of overlap. Next, we're going to talk about more application of the theory and new research that's being generated. We're going to talk about the glutamate theory of schizophrenia. It's the newest biological model of schizophrenia. This directly challenges the dopamine hypothesis. Earlier in this presentation, I spoke briefly on glutamate as one of the 6 major neurotransmitters. I also spoke briefly on the dopamine hypothesis. Basically, the current medications that we use to treat schizophrenia, the antipsychotics, the atypical antipsychotics, they're not effective against the negative symptoms of schizophrenia. Even when dopamine itself is stabilized, it does not help with the negative symptoms of schizophrenia. Glutamate, on the other hand, is a product of the Krebs cycle. It also contributes to the regulation of NMDA receptors, which are necessary for cognitive processes. Too little glutamate can lead to hallucinations. Overstimulation of glutamate can lead to overstimulation of the NMDA receptors. This causes increased intracellular levels of calcium, and it causes the neuron itself to fire more. And this can lead to neuronal death. We do know that schizophrenia may have an inflammatory process it already has an inflammatory process that may cause neuronal death. We do know that cell death is known to play a role in schizophrenia. Treatment with glutamate has not been promising at this point, unfortunately. Work is still being done, as 1-glutamate does not cross the blood-brain barrier and a carrier molecule may be needed. Based on the glutamate hypothesis, many drug targets have been proposed and some are under investigation. For example, drugs that target the co-agonist binding site of NMDAs are being studied right now. Psychopharmacology has brought clinical benefits that have truly revolutionized modern psychiatry, but it only provides symptom relief without resolution of underlying conditions. Our field needs to continue its efforts to understand how psychiatric disorders are linked to functional networks of genetic, neuroanatomical, and environmental interactions. The neurotransmitter theory of mental illness is part of the holistic care of a patient. Research shows that the most effective treatments for most mental health conditions involve a combination of both medications and psychotherapy. Thank you.